Reddit stories from r/AskReddit. Surgeons of Reddit, what was your first surgery on a real living human like? Pretty routine to be honest. Had so much training leading up to it and a senior surgeon standing by offering advice and reassurance as needed that it felt almost the same as training. Helped that it was a fairly basic and routine surgery with very little risk. Does the patient get told it's their surgeon's first operation? Of course, they need to know and give consent while you're a student. We talk with them beforehand to walk them through the process, get things signed off and answer any questions first after all. They're fully aware it's your first time going live, but know you have an experienced OR team and surgeons on hand in the room as well. Most people don't have much umbrage to the process when it comes to simple procedures, and are just happy to be getting surgery. After graduation, when it was first true solo, the above doesn't apply so much. Not a surgeon but a doctor. My first day of clinical rotation I scrubbed in a crash C-section. There was so much blood. It was kind of awesome though. You gave me flashbacks to a farewell to arms. Currently in school and experienced the weirdest thing during my first major surgery, asciting. Scrubbed in a Lefort 1 down fracture, osteotomy and sinus lift. Basically, a Lefort 1 is when they peel the gingiva, your gums, on your maxilla, upper jaw, back, then use a sawzall to cut from behind the bone that support your last tooth, up, and over through your nasal bone and across. Then they do a down fracture, which means they intentionally break your upper jaw and push it down towards your lower jaw. They now have access to your sinuses where they can clean them out and get rid of cysts, do whatever they need to do. They then screw your upper jaw back in place with plates and put you back together. It's a very routine surgery. So basically 1 mo into school and I went to go shadow my friend who was a resident at the time. He pulls me into this surgery and next I know I am holding these metal retractors and pulling this guy's upper lip back as much as possible. No shit, this guy's nose is up by his forehead and I'm looking down this guy's nasal septum as they saw his face in half. It went fine. But at one point I remember my vision just cut out. Like it just went gray. I could hear. I didn't feel faint or like anything. I felt absolutely fine, but at some point I was like, guys, not to bother you but I can't see anything. Of course, for them it's not uncommon to have students passing out all over the place. They asked if I needed to sit down and I said that I felt fine, I just couldn't see anything. A nurse brought a chair over and helped me sit down as a precaution and the next thing I knew I could see again perfectly fine. It's not even like my vision came back like I saw it do so, more like after 10 seconds of sitting there I realized that I could see again. So I just stood back up and we finished closing the PT up. Truly bizarre experience. Not to make a false equivalence but I can only describe it as a brief conversion disorder, but I hadn't experienced any sort of trauma that would cause it. Posting because maybe there's someone else who have experienced it. Maybe my brain saw the PD's head in half and was like, oh boy, you ain't wanna see this, and cut the cord even though I'm consciously fine with blood and gore. NSFL. If you're interested in the procedure, https://www.youtube.com/watch?v=cumnimjsfoho. Not a surgeon, but medical student is pretty close. My first operation was a C-section. I wasn't running the show, but I was what they call first assist, meaning I'm the first person on deck if the surgeon's hands are occupied. Mostly I was just holding retractors, which are curved metal tools that you use to pull back on the skin or whatever might get in the surgeon's way. I distinctly remember not wanting to pull too hard on the retractors, but I got scolded for not pulling hard enough. Turns out you can pull as hard as you like, skin is tough shit. Also, when you perform a C-section you need to split open the amniotic sac, which contains a whole lot of fluid. I didn't put on shoe covers because I was so excited to scrub in the first time. My shoes got drenched. I lost a set of shoes, but I learned a valuable lessons about shoe covers that day. I was induced, so my water broke in hospital. Something they always told me was it's not usually the Hollywood-style water breaking, but more like a leak. Except mine was totally the Hollywood style. I woke up, within a minute heard a pop, then a gush. Since I was in hospital OBV, the fabulous nurses had prepared, so there were a number of pads already down. I called them, and the nurse came in saying sometimes you pee yourself and it's totally normal, while helping me up so she could check. And then was like, oh my yes, your water broke, let's get fresh bedding. I'm imagining that while on the table, thinking goodness yes that's gonna be a bit of a splash. To be honest with you I was doing fine for the first 30 minutes, I removed multiple fractures and foreign objects but as fatigue set in I accidentally touched the sides and the patient's nose illuminated and he made a buzzing sound even though he was under heavy anesthetic. I knew that my career was over there and then. Did you get fired or quit after that? Is that when you found surgery wasn't for you or? I gave up my position upon the agreement of no lawsuits and access to the medical cupboard for 20 minutes, 0 questions asked. But I still practice medicine from my garage. I like the old ways of life, you could compare me to a frontier town dentist. I've got ambition and a willing nature but lack skill. My first surgery alone was an amputation. I was in the and the chief told me to go amputate a diabetic foot, so I asked who should I go with. I was just a first-year CX resident, and he said go alone. I was scared shitless jaw, but it's a simple procedure, I had watched it many times and assisted, and the scrub nurse was super helpful. At the end I took a picture of the necrotic foot after it was amputated, it just looked so unreal, like out of The Walking Dead. My first surgery ever as a resident was a Fournier's gangrena. Nastiest shit ever, I can still remember the smell. I'll put up the foot photo if I can find it when I get home. Edit, some PPL are saying that posting a 10-year-old photo of an amputated foot without consent is bad, so I guess I won't do it. Well, the first surgery I was in the room for was after I graduated high school. My best friend who was also interested in becoming a physician went with me and it was an arthroscopy at an orthopedic surgery center. When the surgeon put the camera into the joint space, my friend got nauseated and sat down against the wall. He's a lawyer now. The first operations I assisted with as medical students were spinal fusions in adults and children with neurosurgeons and then pediatric orthopedic surgeons followed by breast reductions and cleft lip and palate surgeries in plastics. With the breasts they let me help peel the skin from the breast tissue to make the pedicle that would become the new breast tissue form. On kids with severe cerebral palsy needing spinal fusions for posture I would take the spinal joint facets from the back table and separate bone from cartilage and give it back to use as bone graft after they secured the vertebrae to a rod placed into the hips with metal wires. Then I would help sew close the skin running up and down the back. The adult spinal fusions were similar, had academic discussions and touched almost nothing other than retracting skin. In plastics when they did facial reconstructions or created tissue flaps to repair cleft lips and palates I basically observed and touched nothing but it was inspirational my cool and the surgeons doing that work were worldly and wise and good at conversation. After that I did C-sections and delivered babies and did a ton of prenatal care on obstetric, gynecology clerkship, and assistant with vascular bypasses on the legs of smokers on my general surgery clerkship. Ultimately after some training in most surgical specialties I decided on general surgery as a career. These days I make individualized sculptures from people's stomachs to assist their weight management goals, remove dysfunctional organs, repair injuries from car accidents, gunshots, and stabbings, and do a fair amount of life coaching for people with chronic illness related to lifestyle choices. It's not a big deal. They're asleep and draped and you're only looking at the point of entry into the body and the relevant tissues inside. It's all just meat when they're on the table, just gotta put all that meat back together nicely and not harm any vital meat. First surgery was an emergency ruptured diaphragm from being hit by a car. The senior surgeon was on break and they rushed in without any warning and we had to go. My gloves filled up with sweat and got sloshy. But I got the abdomen open, could see a straight-up hole where the diaphragm has blown out. By this point we are bagging the patient, squeezing the reservoir oxygen bag to force oxygen into a non-breathing patient because there's no vacuum in the chest cavity once it's open to air and the little sacs deflate and stick shut. Perfect timing, the senior came in and repaired the hole and sucked the oxygen out of the chest cavity to create the vacuum again and I bagged the patient and I felt like puking as the adrenaline wore off and I got the shakes. Nice and life-saving work. I was a scrub nurse for the best part of 10 years before now transitioning to be a midwife. My first ever operation was a TURP. A super tiny operation for a scrub nurse that involves pretty much nothing, apparently one of the higher skilled operation for a urologist though. I had a senior scrub nurse doing it with me and I was well supported. We'd also spent like an hour going through what was involved together before actually doing it. I was young 22 yo and I was terrified, excited and full of confidence all at the same time. Thanks Joe, you old school as hell and hard as nails, but you were a great mentor. Am a new scrub nurse 2 months in. I don't remember exactly what my first surgery was, but it was colorectal, no instruments. My job was to hold open a patient's anus. My first day was great. So in the US, medical school training has 2 parts, pre-clinical first 2 years book learning, and clinical last 2 years. After that you do residency, which is essentially like apprenticeship where you are a doctor, but you're under the care of a senior physician that can vary in length from 3 years to 8+ depending on specialty. During clinical years, students are required to go through multiple specialties including surgery, OB/GYN, internal medicine, peds. So most people's first surgeries will be assisting as third-year medical students, which will be around 3+ years before they do any solo. My first surgery was a C-section, and the department didn't really communicate or care for medical students well. Essentially, it was my first day in the hospital and I was thrown into an operation where I held retractors and did some suction. But this lady was having a baby that was growing 4 weeks too slow for where it should have been, and she was only at 27 weeks pregnant, so that poor thing came out looking like an alien, blue with bulging eyes and a small head only 3 to 4 pounds. Extremely jarring in retrospect, but because I had no idea what normal looked like immediately after delivery, completely missed me. Not a surgeon but a patient. Also doesn't have surgery, I just went to A&E. This is about what must have been some nurses oh shit moment. About 2 a.m. I'm sitting in a super comfortable patient chair bed thing with an IV in and drowsy on painkillers after my parents took me to A&E, waiting for blood test results to come back and a bed to become available. The woman who'd been looking after me, can't remember if she was a nurse or an intern or something, I wasn't really paying attention, approaches my parents and says that there's nothing wrong, that I should just go home, and free up the space for other patients. Parents are skeptical, they expected that I'd at least be prescribed some painkillers to take for how bad it was, but go along with it. 3 a.m. at home, I get a call from the hospital asking where I am, that they need me to return to my bed chair thing now because the tests came back and I needed to be admitted. I explained that I'd been discharged and was at home, then handed the phone to my parents since they knew the details and so I could focus on grabbing some comfortable clothing. We get back to the hospital about 20 minutes later, and are apologized to by a different doctor, looks like he's supervising this area, and settled in again with an IV. We learn from the patient next to me that we missed a right show. Apparently the woman who discharged me thought that I was a drug seeker, and after listening to me complain about pain over and over, she discharged me. I guess she was really confident that she was right. When the doctor came back with the results and found me missing, he was not very happy that I'd apparently decided to go walkabout. Anyway, the nice lady at the front desk talked to my parents and got the details of what had happened, told the doctor, and he verbally tore the woman a new asshole for doing something so stupid. She tried telling the doctor that I'd just checked myself out and left. I don't know if he sent her home or what, but someone else took over my care until I was transferred to another department. First surgery ever was assisting on a gallbladder. I had to hold the laparoscopic camera and made everyone seasick from moving too much. Most memorable early surgery was a simple lipoma removal. First thing I was let to do on my own. Memorable because the attending surgeon was yelling at me to find all the terrorists and kill them all. They referred oozing and bleeding as terrorists, so they just wanted me to stop any bleeding. They were a strange sort of person. First surgery as an attending surgeon was an appendix. Went fine but took way longer than normal because I was paranoid about every little step with no one watching me. First emergency surgery at 2 a.m. was for perforated diverticulitis. This is something that no amount of training will ever prepare you for. The training will get you used to all the steps, but being woken up in the middle of the night to a sick patient to fix, no one else around to help, everyone looking at you for answers and what to do next. It's a scary feeling when you realize you're the smartest person in the room and the only one that can fix what's going on. I'm an Obgyn resident and also did a year of general surgery. As a student, the first surgery I was really active in rather than just retracting was a burn sitter on a morbidly obese dude whose abdomen was completely without skin. I used a machine to harvest skin off the legs, then used another machine to split the skin so it could be spaced out over more area. After that it was suturing skin to fat, pretty much. Burn ores are kept very hot, like up to 110 degrees. The other student had to leave because she was getting lightheaded. I knew I didn't want to do burn surgery, but God bless those who do. First C-section was with an attending who was crazy fast. He could go skin to delivery in under 50 seconds in emergencies. I had trouble keeping up. He didn't give much advice but told me I needed to learn how to hold my needle pickups in my palm rather than putting fingers through the holes. That would give me better mobility and speed. I stole a set of disposable pickups and put them in my car and would practice locking and unlocking without looking while I was driving, no fingers in the holes. I'm at a different program now and encourage the interns to do the same. I'm annoyed when they don't. Medical student here. I worked in the orthopedic surgery department at an army hospital in Pakistan. I was a third-year medical student out of a total of 5 years, and my best friend's uncle was a general in the army, and if you have connections in the army, anything is possible, so we had him hook us up with an orthopedic surgeon as trainees. We weren't technically allowed to assist, but we passed ourselves off as surgery trainees and nobody asked to see our credentials. First was a crash course on surgical instruments. Orthopedic surgery tools are exactly the same tools one does woodwork with. Saw, drill, hammer, wedge, everything. The first surgery was an artificial hip replacement. The surgeon excised the necrosed femur using drills and this weird instrument, made sure to watch the nerves, and carefully inserted an artificial hip in place. Then the most ridiculous scene ever happened. 5 full-grown men pulling on the patient's leg to guide it into the socket of the artificial hip joint. It was hilarious. Everyone was pulling so hard I was worried the patient's leg was gonna rip off. When the joint got put into place, everyone started congratulating each other. It was ridiculous. The patient woke up pretty soon after the surgery and was in a lot pain but recovered fine. The smell of burning bone gets to you. I hated it. I used to spray a little bit of perfume on the inside of my surgical mask to try and avoid it. Plus you have to descrub and rescrub every time you want to go drink some water or use the washroom or check your phone. It's a hassle. They also allowed me to do my first stitching of the patient. Man, that sucked. I messed up like 5 times. Skin is super stretchy and rubbery, and you really have to have a nice technique to stitch correctly. Plus using the forceps to navigate that needle thing to stitch is very hard. I felt so bad for the patient and tried to go away, but they wouldn't let me till I performed it correctly since I was under the guise of a surgical trainee. But yeah, my time there made me decide never to go into surgery. You aren't getting many real replies, so here's one. TLDR: surgery is a graduated set of responsibilities. First, surgery is routine, but you're not doing anything beyond your abilities. It's not like you would think. I'm a surgery resident, and the first surgery you do as a resident you typically don't do the whole case. You'll get to do the skin incision, the suturing, maybe some of the actual surgery parts of the case, e.g. dissecting to find the appendix, or taking the gallbladder out of the fossa, but in all likelihood, that will be a more senior resident or the attending. If you do get to do it, your hands will be held by the attending the whole time, not literally, figuratively. Over time, as attendings become more confident in your skills and you become more confident in your skills, you get to do more and more of the case. Eventually you will get to do the surgery on your own, depending on the surgery of course, but again, this is over the course of years and not medical school. I'm talking years of residency. In terms of what it's like mentally, it really wasn't a big deal. You've been in the OR as a medical student and more than likely been suturing, using some tools, etc., so the familiarity is there, and I didn't feel like it was an emotionally big or charged moment, just routine. Thanks for watching. Be sure to subscribe for more Reddit stories like this.